Hi, I'm Heather with Parkway Sleep, and you have chosen the N20 mask for your therapy. This is one of our nasal cushion masks, which means it goes over your nose, kind of like a little elephant trunk. The mask is made up of 3 parts. There is your cushion, your frame system, and then your headgear is the fabric piece on the back. Please refer back to your paperwork to see how often to change these. The nasal cushion is 2 weeks, the headgear is every 6 months, and the frame system is every 3. This mask, as I said, goes over your nose. There are 3 sizes for this cushion. There's the small, medium, and the large. We size it like this because it allows you to, the width of your nostrils, to make sure they don't rub on the side of this mask for your comfort and to make sure you're getting a good seal. If you have rubbing on the bridge of your nose or leakage into your eyes, most likely you have the wrong size. With this mask, you have the quick release option for the tubing at the front of your mask. So if you get up to go to the bathroom at night, you just take this off and it is connected to your machine. And when you come back, all you have to do is put it back on and you are all set to go back to sleep. With this mask, for cleaning, again, you grab here and top and bottom of the pillow and your cushion will pop right out. We suggest Dial hand soap for this, or if that Dial hand soap causes any irritation for your skin or you have sensitive skin, you can use something like non-scented baby shampoo. Just put the water and the soap, rub it between your hands, get any oil and skin off of that, and you are welcome to let it dry and use it again tonight. The frame system and the headgear get washed weekly. There is fabric on this, so you will need to scrub it a little bit more than possibly the silicone if there's any debris on there, but you will wash it once a week with that same soap you use for your cushion, let it air dry, and it'll be good to go to use it again that night. This mask has magnets as a connector on the bottom 2 points of your 4-point headgear. These magnets are not recommended for use with patients with medical implants such as pacemakers, just because it is a magnet. Again, that headgear has 4 points, the 2 points up top and then the 2 points on the bottom. The headgear will sit, this part will be on the top of your head, and then this will sit at the base of your skull, like so. When you go to adjust it, we suggest doing the top 2 at the same time and then the bottom 2. If you adjust too tightly on either side, you can lever the cushion away from your face, which could cause leakage into your eyes. So make sure you tighten at the same time and not to over tighten. Sometimes leaks are more common from over tightening than they are from under tightening.